Peace be upon you and God's mercy and blessings. Doctor, my son has tonsillitis and so on. The doctor told me we should remove them, but the last time he had tonsillitis, it was very severe and made him extremely ill. The doctor said he has an abscess behind the tonsils or an abscess in the tonsils. What does it mean to have an abscess on the tonsils? And is it really necessary to remove the tonsils or not? Should we remove them? What happens is that when a microbe enters the tonsils, sometimes the inflammation that occurs in the tonsils is just redness and inflammation, and that's it. But sometimes pus accumulates on the tonsils and it becomes a purulent inflammation of the tonsils. This purulent inflammation of the tonsils usually requires us to take antibiotics, either by injection or intravenously, because the microbe is strong and the symptoms are severe. So, what's the difference between purulent tonsillitis and a tonsillar abscess? What happens is that beneath the tonsil, there is a muscle, the pharyngeal muscle. This muscle, the pharyngeal constrictor, has a space between it and the tonsil. If purulent inflammation occurs in the tonsil, it can spread to the space between the tonsil itself and the muscle underneath it. Is this dangerous? Not really, but of course the symptoms are much more severe than regular tonsillitis, even more severe than purulent tonsillitis, the one we treat with antibiotic injection. The symptoms include the patient having a very high fever and being unable to eat. There is also very severe pain when eating. The situation can escalate to the point where the person's voice changes. Their voice becomes muffled, or you feel like there's swelling inside their throat and they can't speak properly. Breathing can also be affected. It can also happen that the infection starts to spread from that area, from the space between the tonsil and that muscle, through the veins, leading to complications and even infection in the neck itself. But don't worry, what usually happens is that when we diagnose this problem, if we catch the patient before an abscess forms, when it's just a purulent inflammation and it's starting to move to that area or the space between the tonsil and the muscle, we immediately start intravenous antibiotics, give painkillers, and make sure the child or adult is eating well, because this can happen in adults too. We try to give antibiotics and don't do anything more than that. So, how do we know if an abscess has actually formed? The doctor comes in with a needle and draws from the swelling around the tonsil. As soon as he draws, he finds pus coming out. At that point, it has to be opened. Of course, the patient usually comes in feeling very unwell with a very high fever, sometimes to the extent that he can't eat, as I mentioned before. Breathing is difficult, and sometimes he can't even move his neck. Because of the pain, he tilts his neck toward the side where the abscess is and can't move it. At that point, we might open the abscess with a scalpel under local anesthesia while the patient is sitting in front of us, or we might open it in the operating room under general anesthesia to drain the pus. There are two approaches or schools of thought in dealing with these cases. Some say that since we're going to open the abscess and there will be pain and we might need general anesthesia to open it, then why not remove the tonsil at the same time so the problem is completely resolved? Others, and this is the safer approach, say that we should treat the abscess first or drain it, whether under general or local anesthesia, and after it heals completely, we wait about 4 to 6 weeks, so about a month and a half to 2 months after the abscess has fully healed, and then we remove the tonsils. Is the situation dangerous? No, it's not dangerous or anything. It's just an abscess that forms behind the tonsils, usually after many repeated tonsil infections. If we get an abscess behind the tonsils, does that mean we have to remove the tonsils? Of course, it's preferable if the diagnosis is correct, if it's really an abscess behind the tonsil with pus, not just a regular tonsil infection. If it's just a regular tonsil infection, we might not need to remove the tonsils. We just treat it and that's it. But if it's pus and an abscess and we had to open it and drain the pus, then yes, it's better to remove the tonsils. People who prefer to remove them while there's still an abscess are at risk of problems like heavy bleeding because the area is already infected. So it's not advisable to perform surgery in a place that's already full of pus. But after 4 to 6 weeks, we should remove the tonsils after the infection has healed. So the issue isn't scary, even though it's very painful, but we should know that these tonsils need to be removed. Personally, I prefer that we wait a bit after we've dealt with and drained the abscess, and then after some time, we remove the tonsils. Wishing him a speedy and complete recovery. If you like these videos, give us a like and subscribe to the channel so we know you're waiting for more videos from us.